This is John. He's enjoying life and staying active, but it wasn't always this way.
A year ago, I went to see my doctor about my snoring, my poor sleep, and lack of energy. Okay, someone convinced me I needed some help from my doctor.
Like many people, John suffered from symptoms like snoring, poor sleep, and chronic fatigue.
He actually experienced periods of shallow breathing and may even have stopped breathing hundreds of times per night.
John, you okay?
Yeah. Thanks. These episodes caused me to wake up a lot throughout the night. They're called micro-arousal, so I never get a good night's sleep. My wife says that it sounds like I actually stopped breathing in my sleep. I mean, if it weren't for her, I'd have never known. In fact, most people aren't aware that they're waking up throughout the night.
John's doctors ran a sleep study and told him that he has OSA. OSA, or obstructive sleep apnea, is not uncommon. It occurs when air cannot flow into or out of the person's nose or mouth, although efforts to breathe continue.
My doctor said that CPAP, or continuous positive airway pressure, along with some lifestyle changes, is the best treatment for me. Now, CPAP involves a flow generator, tubing, and a comfort-fitted mask, which I like a lot. He also said that he prefers Apnea Healthcare as a provider of choice because of their qualified staff, their equipment selection, and all of their convenient locations. I find CPAP to be really comfortable for me and easy to use every night.
Some may find it difficult accepting CPAP therapy, some due to higher pressures or other concerns. These patients may benefit from other forms of positive airway pressure, which are more like natural breathing. If you find it difficult to use CPAP, please discuss with your apnea respiratory therapist. We will be happy to talk to your doctor about your concerns or therapy needs.
This is my respiratory therapist. She gave me very clear instructions on the proper use and care of the equipment.
The benefits from therapy are directly associated with how much the equipment is used. It is important for you to use your equipment as much as possible for you to gain maximum benefits. Getting acclimated to CPAP use can take some time and patience, but it's definitely worth the effort.
Try these tips for getting used to your therapy. Try holding the mask up to your face, then removing it while watching TV to get used to having the mask on your face. Use for short periods, with or without pressure, while awake to acclimate. Try setting reasonable goals as you are able. Use with sleep for 1 hour, then 2 hours per night, working up to a full night's sleep. Remember, some insurers require minimum nightly use for payment. Your clinic leader can give you specific information if this applies to you.
You should follow manufacturer recommendations for cleaning. See clinic presentation for details. Even with the best routines, parts can eventually become resistant to cleaning, lose their shape, and impact your therapy if not replaced. Coverage varies, but generally pillows and cushions monthly, mask tubing every 3 months, and headgear every 6 months.
As your partner in therapy, Apnea has a number of convenient ways to help you with resupply of vital positive airway pressure components, including auto resupply, phone reminders, email communications, and branch clinic visits.
OSA and other sleep-disordered breathing conditions are associated with chronic conditions such as obesity, diabetes, hypertension, erectile dysfunction, heart failure, and others. Regular, consistent use of positive airway pressure therapy may help you manage these conditions.
Just a few weeks ago, a good night's sleep seemed like a dream that was out of reach for both John and his wife. But thanks to someone, John sought help from his doctor and saw how CPAP could change his life.
Because it's not just about me, it's about us. And now I keep my equipment clean and I use it every night because I know that that's what keeps me healthy and lets me live the kind of life that, well, that we want to live. And I know that we'll never go back to the way things were.
The life you want isn't out of reach. It's right in front of you. And thanks to Apnea's team of clinicians, you can easily change your life and never go back.